Well, beauty brand Dove and others on social media are speaking out against a new TikTok filter called Bold Glamour, which uses AI to morph users into more attractive versions of themselves on social media. Critics say these filters have the power to dramatically distort reality and reinforce unattainable beauty standards, and could lead to a plastic surgery or cosmetic procedure craze among young people. Joining us to discuss, child and adolescent family therapist, psychologist Darby Fox, and board-certified dermatologist Dr. Doris Day. Great to have both of you with us. Dr. Day, I'm going to start with you. You are a very respected and renowned cosmetic dermatologist based here in New York City. You give your advice to magazines around the country and beyond. Have you seen increased body dysmorphia as a result of these types of perfection, or I should say fake perfection filters?
Absolutely. I've seen two disturbing trends. One is people coming in younger and younger, asking for features that are not organic or natural to them. And the problem with that is that they're missing their own authentic natural beauty. And the other problem is that if you look at these filters, what they do is they make people look more amorphous. They take away features. They don't define features. So by looking more amorphous, more filled, you lose definition and you lose what makes you, what your signature features are and what makes you especially beautiful. And I think that's a real problem because they're going to miss out on knowing what they look like as they age. And what a pity to get older and not even know what you could have looked like or how beautiful you really were. And so a lot of what I do is I help redirect them. I help them see their beauty and I point out their best features and help them see that and how they're the ones who have that. This is their gift. And we can find ways to celebrate and enhance it by using sunscreen, by watching their diet, by doing all these other things. And so many of these people are open to that. They just need to be told that it's okay from someone who has authority.
That's a great point, Dr. Day. Darby, you know, of course, as a therapist and psychologist, how do you speak to families or even younger women or kids, or it could be men, whoever it is, to try to say, okay, listen, this is an unrealistic version of reality. What you see, even whether you're looking at the Kardashians or celebrities or on the Oscars red carpet, there's a lot of things that have been manipulated to make it look like a more perfect version of real. How do you handle that?
So what we want to do is really help them focus back on the internal piece. As Dr. Day said, it's unattainable if they come in with pictures or they are complaining about a certain body part. It's very hard to change it and keep it satisfactory when we're looking at something that's an external piece that we have no control over. So as a therapist, we really try and build up their self-esteem and go back to looking at what is unique. Actually, your nose is kind of great. It reminds me of your grandmother, or whatever piece it can be that gives them an individual, unique perspective, as opposed to some kind of fabricated look that we see in social media.
Yeah, Dr. Day, I mean, you alluded to this. It gets to the point where everyone kind of looks the same. I mean, you can look at different pictures on Instagram if you're scrolling through. It's really a lot of identical people. And like you said, you're kind of taking away the individuality and what is unique about you. I remember I used to work in magazines and we did a story for a teen magazine called Work Your Quirk. Play up those freckles, play up that prominent nose, play up those curls,
that
whatever it is.
Asymmetry, right? Everyone's a little bit asymmetric. Right. And all of those features do make us special and unique and beautiful. The problem is that people are sometimes chasing things that don't exist. When you look at a lot of these features, they're being told that these are trends, like a dress is a trend or a hairstyle is a trend. Well, you can't get fillers and neuromodulators and treatments like a trend, because we're learning that these do important things that have lasting effects that go beyond what we saw in the clinical trials. So we're learning fillers can last decades, not just months or a year or so, that neuromodulators change the way you express, and that can change your emotions that go along with that. Not being able to express appropriately or make facial expressions does affect your emotions, and we know this from scientific data. So altering features is not just like trying on an outfit And if you don't like it, you can change it, or you could just make it go away. It's much more involved than that. And I think that there is something that goes with youth, like a sense of immortality and a sense of adventure and daring. And a lot of times people who are young don't do it to necessarily be more beautiful. They do it to make a statement.
Really great point.
Right now, the statement that they're making is sometimes confused by one, wanting to fit in, and two, wanting to stand out. And it's my job to exactly be what Darby said, is to be a doctor of self-esteem and help them feel so good about themselves that they won't feel like they have to do those things, and they can separate out reality from the app.
Great point. And that actually, what Dr. Day said, Darby, actually makes me also think of a lot of not just plastic surgeries that we've seen that have been increasing among Gen Z, but then also a lot of the transition surgery we've had. These are often, again, these are life and body altering surgeries. They're not a trend.
And we really don't want to do that too soon or too carefully, because as I think I've spoken before on Newsmax about, is you're coming into your sexuality as you are a young teen and throughout your teen years. So if we alter that physically and irreparably, then often that adds to the problem of who am I? What is my real identity? And that's tragic. Again, we want to go back to really helping people create and distinguish themselves individually, who they are, as opposed to making them fit in or look a certain way. And we've seen a lot of long-lasting effects with that.
And Dr. Day, we're almost out of time here, but I just wanted to get your thoughts. Are you seeing a lot more Gen Z younger people coming in more and more wanting different, whether it's plastic surgery, but you're a cosmetic dermatologist. Are you seeing younger people coming in wanting and craving perfection? And what kind of things do people ask for?
So they ask for a lot of lips, a lot of neuromodulator, Botox for the forehead. Their moms often bring them in, and oftentimes it's because the moms come here and the moms know that I'll say no. So they bring them in because it's a safe place for me to be able to explain. And they're usually open to hearing it. When they get here and we have the conversation, it's just the communication that's important. Doctors have to communicate. Someone asks for something doesn't mean that's what they really want or that's what we need to do, but we need to help them through it and to have them feel heard. You know, I listen, I make sure that they know that I get what they want and that I'll guide them to where they want to go.
Fantastic. All right. Great conversation today on what you like to call the other view here on Newsmax. Dr. Doris Day, Darby Fox, thank you.
Thank you.
Well, check this out. Rod H. spotted Newsmax on at Rob